question of the day board review. This is a micro-learning channel with all things critical care. So here is your board question. So here is a critical care question. In addition to the risk of major congenital malformations, maternal exposure to which of the following anti-epilepsy drugs is associated with an elevated risk of autism spectrum disorders and a lower IQ when assessed in early childhood? Choice A, carbamazepine; B, lamotrigine; C, phenobarbital; D, phenytoin; E, valproic acid. The answer is E, valproic acid. So valproate is an anti-epileptic drug that's been used for over 40 years now. It's associated with a triad of risks when used during pregnancy, including major congenital malformations, an elevated risk of autism spectrum disorders, usually when they're checked at the age of about like 5 to 6, and a lower IQ in children. Cognitive impact, there was a study called the NEAD study that found that children exposed to valproate in utero had lower IQ scores at age 6 compared to other AEDs. The autism risk is 3 to 5 fold higher with valproate compared to some of the anti-epileptics. Looking at the other questions, looking at the other choices, lamotrigine, it's generally, or Lamictal, it's generally considered safer than the other options during pregnancy. Obviously, there are, really hard to come up with significant data on safety in pregnancy just because you don't end up exposing a lot of the patients to unnecessary drugs during pregnancy. Levetiracetam or Keppra, it's generally one of the safer drugs. It's used more widely, at least in North America. Carbamazepine, for the longest time, has been associated with a whole laundry list of side effects, and with specific malformations associated with it include neural tube defects. It's not necessarily been associated with significantly lower IQ in this particular case. Phenytoin is associated with something called the fetal hydantoin syndrome. This is your USMLE step 2, step 3, question that comes up all the time. That's not what we are looking at in this particular case. So thank you for watching, and we'll be back with another episode, another question in the next day or so.